mutually reinforcing contributory objectives. Basically, this means activities that the Global Fund will do that strengthens the institution in achieving its objectives of ending AIDS, TB, and malaria. There are three mutually reinforcing contributory objectives that have some relevance for sex workers. I've talked about these a bit earlier in the video, but I think it's worth going into a bit more detail with two of them. The first one is maximising people-centred activities. So, people-centred quality services means very little for sex worker communities in reality. Although the Global Fund may challenge this assertion, the whole section offers very little that is practical, realistic, or will make a difference to the sex worker community. It is full of text that can be found in almost all UN system documents and which in reality we all know has failed to improve services offered to criminalised populations. But perhaps it's a commitment that can be used in advocacy when services are of poor quality or not responsive to community needs. The one that is really important is the second one, is maximising the engagement and leadership of most affected communities to leave no one behind. Now, this section starts with a strong statement about the role of communities in the founding and development of the Global Fund, and goes on to commit to reinforcing the engagement and leadership of most affected communities as experts in decision making, service delivery, and oversight. Now, this is a very strong, clear commitment that sex worker-led organisations can use in advocacy for greater recognition and engagement in Global Fund processes. And there are three broad focus areas, which is slide 6, that the Global Fund strategy approaches with the aim of maximising engagement and leadership of communities. And these three broad areas of focus are: 1. Facilitating inclusive country coordinating mechanism processes. The Global Fund states it will do this by strengthening the capacity of CCMs to facilitate inclusive processes, formalising CCM subcommittees for key populations, and annual reviews of CCM composition and representation. These commitments should support meaningful involvement of key populations, including sex workers. But CCMs should already be facilitating inclusive processes. Key population subcommittees must not be a substitution for representation on the CCM. And what will be the point of annual reviews unless the Global Fund requires implementation of its own policies? The strategy narrative also highlights increased access to and use of data, greater access to technology and virtual tools, including as an opportunity to mitigate unequal power dynamics. This is unrealistic without resources being provided to key population-led organisations, and shows little understanding of the realities of sex worker communities on the ground. While the intent to improve things is there is little understanding of the realities in countries for criminalised key populations. The second broad area of focus is evolving Global Fund processes and guidelines to support community-led service delivery. The intention here is to assess and revise existing Global Fund policies to better ensure funding reaches community-led organisations, and then to strengthen secretariat and principal recipient capacity to track and report on investments made through community-led organisations. This should open up opportunities for sex worker-led organisations to be considered and supported as subrecipients, and to address existing barriers to this. And the third one is expanding community partnerships in support of more inclusive, responsive and sustainable HIV, TB, malaria responses and systems for health. This includes a commitment to elevate the expertise of communities to inform technical discussions and advance programme quality. It mentions promoting engagement of communities as providers of technical support and the recognition of community-led monitoring as a critical source of data for decision-making. This is to be welcomed, especially as it implies recognition of the expertise of sex workers and sex worker-led organisations. What it does not do, however, is acknowledge that this also requires changes in attitude within the Secretariat and at country level with decision makers. This will require ongoing advocacy which can be supported by the Global Fund's own commitment in the strategy. Slide 7. Then there is a section maximising health equity, gender equality and human rights. And this third mutually reinforcing contributory objective of relevance to sex workers. This is really important and it's quite complicated. The section starts with a strong acknowledgement of the inequities that exist and that human rights, gender-related barriers, stigma, discrimination and criminalisation increase vulnerability to HIV, TB and malaria infection and limit access to services. To address these issues, the Global Fund will focus on scaling up programs and approaches to remove human rights and gender-related barriers and leverage the Global Fund's diplomatic voice for more equitable, gender-responsive and rights-based responses. Excuse me. So what does this actually mean? Well, to achieve this objective is complicated and requires many areas of change and increased effort. These are the most relevant that are listed in the narrative. Adopting a portfolio-wide differentiated approach. Well, this means responding to every country context differently and using different levers such as finance and policy to incentivize investment to address stigma, discrimination and gender-related barriers, particularly for people with TB. Strengthening country ownership and building on lessons from breaking down barriers and trying to ensure programs are sustained and embedded. A commitment to confront the criminalisation of communities. This means using investment to challenge laws, policies and practices and supporting investments in advocacy and the monitoring of reforms to harmful laws, policies and practices. This includes challenging the criminalisation of sex work. Initiating a partnership-wide focus on supporting gender transformative programming. Expressions used in the strategy like increased support, promoting the role, supporting integration, more proactively engaging, and establishing innovative partnerships are all quite weak and do little to encourage confidence that this will make a difference. Strengthened support for sexual reproductive health and rights programs should hopefully increase access to these services for sex workers by making them more accessible. Targeted gender-based violence prevention. This should include investment in prevention and response interventions, which may provide an opportunity for sex workers. There are 3 commitments targeting adolescent girls and young women. but unfortunately nothing that might be particularly relevant for sex workers. A commitment to use both quantitative and qualitative data to identify drivers of inequity and inform responses, and a commitment to proactively advocate and challenge discriminatory laws, policies, and practices. This is a fine commitment, but which does not really have any value in real terms. And the skepticism is based on the fact that the Global Fund is unable to ensure errant CCHENs adhere to their policies and guidelines about involving key populations. So, a commitment to influence at an even higher level seems unlikely to be successful. The commitment to this objective, maximising health equity, gender equality and human rights, is genuine, and this was very clear during the development of the strategy. However, it will take all of the above that I've just mentioned to be implemented effectively across the whole of the Global Fund Secretariat and all country portfolios. And this would be greatly enhanced by a designated key population funding stream that not only builds capacity but supports an increased focus on the necessary changes to achieve this goal.